Welcome, everyone. This is Dr. Mercola helping you take control of your health. And we're going to be interviewing Dr. David Brownstein, who is a physician, been around the block about as many times as I have. And he has a clinic out just outside of Detroit with 5 clinicians in there, 3 physicians, 1 PA, and 1 nurse practitioner. And they've treated a number of patients successfully, not successfully, very successfully, with a regimen that you're going to be incredibly excited about because it includes my absolute, without any micro doubt or question at all, my favorite intervention for COVID and upper respiratory infections with this nebulized peroxide. But he has a far broader approach that we're going to go into detail. So welcome. Thank you for joining us today.
Thank you for having me.
And your protocol involves something you've been using for about 20 years, it appears. And, so it's an oral intervention. And then you just recently this year revised it for COVID-19. So give us a history as to how this came to be.
Well, the history goes back about 28 years when I began practicing holistic medicine. Of course, we would see people with influenza and influenza-like illnesses every fall and winter. So I started searching for things that would help people's immune systems, take care of and recover from these viral illnesses that they got and make them stronger. We initially started with using vitamin C and vitamin D. I started to check vitamin D levels in 1992 and finding most of my patients were very low in vitamin D. So what I found was the vast majority of my patients, well over 90% were deficient in vitamin D. And those who just had more chronic illnesses and were sicker in general, they usually had lower levels of vitamin D. I began, initially using vitamin C and D, and then I came across vitamin A. And I originally read the research on vitamin A and measles, and how much vitamin A helped third world countries when they had measles infections, and helped these children and adults, have a mild case of measles and recover uneventfully if they had enough vitamin A. So I quickly added vitamin A to the regimen. And then a few years later, I learned about iodine. And, iodine has direct virucidal effects. It has immune system effects. It helps the white blood cells produce hydrogen peroxide to fight viral and bacterial infections, and as well as its thyroid effects. But, iodine got added to the regimen. And so the original, treatment of our patients was, vitamins A, C, D, and iodine at high doses for about 4 days. And what we found was our patients did not develop pneumonia, did not get hospitalized, did not die from the flu and other influenza-like illnesses at anywhere near the rates that they should have, when you looked at the published rates of problems with these illnesses. As I went to an oxidative medicine course and learned about hydrogen peroxide, and we started using nebulized and IV hydrogen peroxide. And everything we added to the therapy, as we went along, patients seemed to get better. A couple of years later from that, I was at a different course and brought back ozone to our practice. And, that was the latest addition to it. So what we found over 28 years of using this therapy is that our patients did well. I never made a claim that this cured any influenza or influenza-like illness. What it does is it supports the immune system, and in multiple ways, and people get over it, just like they've gotten over for eons of time. It certainly makes sense. We want a strong immune system, in place when we get exposed to these pathogenic organisms. So when COVID came around, we were all on edge as a country, and we saw COVID take off in the Seattle area, and then it was moving on west-east across the country. Just before it came to Detroit in the end of February, we were warned that as a country that we're going to have, millions of deaths, and this is going to be the biggest medical catastrophe in our lifetimes, and could rival the flu epidemic from the early 20th century that killed millions. Everyone was on edge, and I had a meeting with my staff at the end of a work week. I remember it was the last Thursday in February, and I told the staff that the first 28 years of our holistic practice was truly practice for this pandemic that there's no immunity to it known, that we have a virgin population that's going to be exposed to this, that there's no treatment known. And I said, I think we've got this covered. I said, I can't guarantee anyone anything, but we've treated coronavirus in the past years, although we didn't culture for it, and I can't tell you exactly what strain of corona, but corona is known to be part of the influenza-like illnesses for eons of time. I told the staff that nobody had to work through this. I was going to work through this. My partners were going to work through this, and we felt like we needed our office open. The patients were going to need somewhere to go, because I predicted that most doctors' offices were going to close, that if this thing really took off, people were going to be scared out of their minds, and the hospitals could be overflowing with patients. And I said, we actually have a therapy I think can help. They really don't. Conventional medicine didn't know what to do with it at that point. We rolled into COVID in Detroit in March, just as it hit New York, New Jersey, and Massachusetts. We were the 4 big hotspots in the country when it happened. And at the beginning, we were in March going out to our parking lot to treat our patients from their car, where they put their arm out the window and we do an IV of hydrogen peroxide and vitamin C in the middle of the snow and sleet and cold weather and the wind. And I vividly remember the snow coming down on my face mask as I'm shaking my head like a dog trying to see what put the IV in. And then at the end of the treatment, we would do ozone, and we didn't want to do IV ozone outside because it was just the elements weren't good, and we weren't inside our office. So we decided to do intramuscular ozone. So we used the muscle in the butt, the buttocks. And so people who were sick and couldn't breathe, we'd meet them in the parking lot at the end of the IVs. We'd open their car door and have them stick their rear end out the car door, and we put ozone in each cheek and send them on their way. And what we heard routinely from patients was that, after the therapies and after they started, we would get them hooked up on a nebulizer too, of nebulizing hydrogen peroxide and iodine. That after they started the therapies, usually after the first nebulized treatment, their airways would open up and they could breathe again, because their big complaint was they couldn't breathe when they called us. And we ended up treating 107 patients that I wrote in the study, the published peer-reviewed study. We had 1 hospitalization, and we had no ventilators, no deaths. And I was, busy interviewing patients and letting them tell their stories and publishing it online with titles of my interviews. There's still hope out there, number 1, number 2, number 3. And we're still treating patients with it. The study was on 107 patients. We probably treated 10 more patients since then, and with still good success with it.
But I had a few questions on your approach. One, I'm surprised, and I was not aware of this mechanism of action, that iodine actually increased peroxide production in the white blood cells, which is the body's, that is the way our immune system works to kill infections. So maybe you can review that, because it's, independent of any medicine, natural therapy, or herb, our body has this system designed to kill infecting pathogens. And why don't you review that for us, because it's such an important, critical element in getting people better.
Well, each of the therapies that we were doing, there's a whole bunch of basis for it. I mean, iodine has direct virucidal effects, so it kills viruses. It also has immune system modulating effects. It helps the white blood cells, produce their hydrogen peroxide to fight infections and to produce other, chemicals to fight infections. Every cell needs and requires iodine. It's one of the most efficient items I've seen in checking people of nutrients for 28 years. Vitamin C is known to increase hydrogen peroxide production as well, when you use it at high doses. I mean, all these things, vitamin A helps, modulate the immune system. Why is none of the powers that be talking about the immune system? I mean, how do people recover from this thing? Perhaps instead of just relying on masks and social isolation, we should be talking about the immune system. How do we support it? And, I'd like to, throw out the question, since when did talking about supporting the immune system become illegal? And when do you have to be quiet about it?
There is a simple and easy answer to that question. And it is because it interferes with the motivation and the goals of the people that have directed this pandemic. And it basically conflicts with some of the therapies they want, which would be primarily expensive antiviral therapies that don't work anywhere near as well, like remdesivir, $3,500 for a course of treatment. And then, of course, the immunizations. that are lined up, that have been accelerated through the system with Operation Warp Speed, putting them into production in under a year, when it's almost physically impossible to do appropriate safety studies in under 5 to 6, 7, 8, 9 years. This is going to be one of the most catastrophic interventions ever when they have this vaccine program.
It's a sad time, you know. I mean, nobody talks about our health. All they're talking about is mask, social isolation, and wait for a vaccine. And until they talk about our health and our immune system, what about the next virus that comes around? What are they going to do about that one? And you're absolutely right about this warp speed vaccine. You know, my comment to this warp speed vaccine to the world is, I hope it's safe and effective, but I don't think I'd be first in line getting this thing. Not when it's bypassing all the safety studies. And safety studies on vaccines have been poor from the beginning, time since we've had vaccines. But this is really something to watch, in real time. So I wouldn't be first in line for this thing. What I'd be first in line with is trying to figure out how am I going to support my immune system and how is it going to be strong. So when I'm confronted with these different viruses, you're not going to depend on another warp speed project. You're going to depend on yourself to get over these things, and we can do it.
Yeah, we can, and that's what I want to dive into now, because I want to help people understand the details of it. But I had some bordering questions around that, though, and I'm wondering, what's in the news quite a bit now, largely because Trump promoted it, was hydroxychloroquine or Plaquenil, which has been an age-old drug used to treat primarily malaria, but also autoimmune diseases. And we've millions and millions of doses, and very safe. I mean, they purport some cardiac arrhythmias, but that's in really unusual, bizarre scenarios. It's one of the safest drugs out there. Not that I'm a big drug proponent, but I'm wondering from your perspective. Now, just to frame the hydroxychloroquine, it works only with zinc. If you give it by itself, or if you give it too late in the illness, it's not going to work, because it tends to prevent viral replication. If the virus is horse out of the barn and you've got all the viruses replicated, it's not going to work. So with that in context, I'm wondering if you encountered any patients of that 107 that were in your initial study that had been exposed or given hydroxychloroquine.
So hydroxychloroquine wasn't part of my 28-year therapy. So we didn't use it.
All right, so these were only your patients. These weren't patients who had heard of your work, came down with COVID, and said, "Oh, Deb, I know Dr. Brownstein's got something they could use," and they were doing something else already. So these were only your patients. These were only
my patients. We had a few, maybe 8 to 10, that were referred by other doctors because they weren't getting better and they were hospitalized, and they may have been given hydroxychloroquine, but they were not doing well when we saw them. And I don't know if they were or they weren't, but my feeling with hydroxychloroquine is that, number one, physicians should have the ability to prescribe it if they see fit, without a doubt. Number two, I've used hydroxychloroquine for autoimmune disorders for 25 years. It is incredibly safe. When it's used appropriately, there's really no, I don't concern myself with the arrhythmias, because you use low doses of it, and the arrhythmias are the high doses of it that are the problem. So I think it should be out there, and I can't speak to it professionally because I didn't use it. But
okay, I'm just curious because it is one of the competing therapies out there. I think my view on it, from not personal experience, because obviously I'm not treating patients, but I think it's clearly effective. I mean, there's no doubt in my mind it's effective, but I think it pales in comparison to the protocol you put together. But I want to get back into the details of what you're using now. I'm just so impressed that you've been using it for like 25 years. It's just crazy good, and somewhat disappointed myself that I missed this. I mean, the closest I got was hydrogen peroxide as a wash for the external ears, and seems to work well there. I'm not sure the mechanism, probably somewhat similar, but gets into the system and generates the reactive oxygen species, somewhat similar to ozone. But it works far better if you nebulize it. So you're using a surprisingly low concentration. I want to get into the details now to give people the understanding of how they can do this thing at home. You don't have to be a rocket scientist. You don't need a prescription. There essentially is no downsides. There's no side effects. So First of all, let's get into the basics. So you need a nebulizer. I want you to talk about the nebulizers, and I want to talk about the concentration and how it's done. Because typically you're using 0.04%. Now the typical peroxide that you buy in the grocery store is 3%. And neither of us recommend that 3% you get for $1 at the local drugstore. We recommend you get food grade because it has less stabilizers in it, which could be harmful. Although at the concentration you're using, I am wondering, I'd like you to comment on this too, that even though you'd be nebulizing these potentially toxic stabilizers that are in commercial grade peroxide, there is such a low concentration. I'm wondering how big of an issue is it, because you're taking that 3% and diluting it by 100-fold or more. So and then when you dilute it, because I want you to go through the dilution process, because you're diluting it with normal saline, not distilled water, not purified water, not tap water, normal saline, so that you don't have an osmotic differential and cause damage in the cells in the lungs when you're nebulizing this, if it was a distilled water preparation.
So I have our staff take food grade hydrogen peroxide. We dilute it down to 3%, or usually we get 35%, I think, and dilute it 10-to-1 down to 3% with sterile water. We do this sterilely. And then we take 3 cc's of that, 3%, and we put it in a 250 cc bag of normal saline. And that's what we have people nebulize out of that bag. So it brings it down to a 0.04% hydrogen peroxide concentration. So, when I started doing...
How'd you come up with that concentration, by the way?
Well, it's funny. When I started doing IV therapies, and especially the oxidative therapies with hydrogen peroxide and the high-dose vitamin C therapies, I just was a little uneasy about some of the side effects, particularly with IV hydrogen peroxide, where they would say you would get phlebitis of the veins and the veins would get inflamed and then go away, because they irritates the veins. So I took whatever concentrations I learned at my courses and started diluting it down further. And I would start 50% dilution and then move from there. And then we would try lower and we'd see what seemed to work the best or not. And that's how we came up with this, because we took the concentration, brought it down, and this was the lowest amount that seemed to work as well as the higher amounts. And we do the same thing with the IV.
You went to even lower concentrations, and lower concentrations didn't seem to help.
Lower didn't seem to help as much as this. This is the lowest we could go to.
Okay.
So when we got it down to this 0.04%, it worked, and there was no side effects. We never heard a complaint. The only complaint we ever heard was maybe it didn't help somebody, but there was no adverse effects that we heard. And along with the nebulizing 3 cc's of this 0.04% hydrogen peroxide, we have them put a drop of 5% Lugol solution in the nebulizer well. And so they would nebulize this combination of peroxide and iodine. And this nebulizer thing really does work. The one thing I'd like your readers or your listeners to know, the handheld nebulizers don't work as well. Mm-hmm. I had a handful of patients who were using a handheld nebulizer and trying it with the same solution. They were calling me back saying it's not working. And so when we got them a desktop model, a little stronger model, mm-hmm. It worked. So I encourage people not to use a handheld nebulizer, use a desktop model.
That was the point of the question I had, is to differentiate between those two. And that's been your experience, which I'm not surprised, because that's been my experience too.
But the nebulizing itself, we heard that same story. I mean, people were thinking they're going to die because they can't breathe. It causes anxiety. It's terrible. I have asthma. I know what it's like when you can't breathe. It's a horrible feeling. And I can't tell you how many of those 107, well, now 116 patients, called, on the phone, distressed and saying, I can't breathe. I feel like I'm going to die. And, once they started the therapy, that just went away.
I mean, the cost of that solution that you're recommending is literally pennies. Pennies or less than a penny a treatment. I mean, it's almost free.
So you mentioned, how cheap and easy peroxide is. My cousin, who I spoke to you before about, he was in 3 hours away in Ohio, and I get a call one Thursday night that he can't breathe, and he's been sick for a couple of days with COVID, and he can't walk to the bathroom without being short of breath. If he walks down the stairs, he's having to sit on the last step for a while and walking up the stairs and go halfway and stop. And he's a couple years younger than me, and he's in good shape. And, he's scared and he can't breathe. So he's 3.5 hours away. First, I was going to meet his wife halfway with the solution and a nebulizer. And, I said, see if you can get a nebulizer. So they procured a nebulizer from a neighbor. And because we were 3.5 hours away, I gave him a formula to make it at home. And it's not my preferred way of doing this at all. But what I had him do was get a quarter cup of pure water, distilled water or filtered water, put a quarter teaspoon of Celtic salt in there and let the salt dissolve. And they made their own distilled water. Their own salt water. And so from that, we took 3 cc's and we added a drop of 3% food grade peroxide to it. And that's what he nebulized. And he, I was calling him about every hour to see how he's doing. After the second hour, because I told him to nebulize every hour. After the second hour, he said his lungs were opening up. He was better. He was about 50, 60% better. And then every time he did it, he got better. And, 2 or 3 days later, he was over this. He was taking the oral stuff along with it, so I don't quite know what worked. But, it cost pennies for him to do that. And, it's a truly remarkable therapy.
Yeah, virtually no side effects. So the experiences you shared and the experiences I've had with it also suggests that it works literally within hours.
Multiple patients told me they felt better within a few hours of doing their nebulized treatment.
All right, so you clearly have demonstrated that you're a pioneer in this area. I personally don't know of any other practice that's doing this.
It was interesting in the middle of the crisis as I was doing a blog post about every other day, and I was posting the interview once or twice or 3 times a week as we got the patients better and they were willing to talk about it. I started hearing from doctors all over the country. And, especially in New York, New Jersey, and they were hospital physicians saying they're dying. They're dying left and right. They don't know what to do. The therapies aren't working. They want to, number one, they want the therapy for their family. And number two, they want to help their patients. So I was hearing from doctors. They were interested. I heard from a couple of local doctors who sent patients to us who, they couldn't help them and they had nothing to offer them. And I've had long-term relationships with them, and we got, those were part of our 107 patients, a few of them, and they got better. I heard from the head hospitalist of 2 hospitals called me from local hospitals who were treating patients, asking me, tell me about this nebulized iodine and peroxide. And so I told them, it really needs to be done in the emergency room, not by the time they're ventilated. But the hospitals were going to use it on the ventilated patients. That's what they told me. I asked them to report back to me. I didn't hear anything back, so I don't know how they did either way with it. But I said I don't know if it's going to help a ventilated patient at that point. And I said it really needs to be done. The first thing they hit the ER is they should be given an IV of vitamin C. They should be given the oral supplements, and they should be given a nebulized treatment. That's what I would do. And it kept our patients out of the hospital, but that wasn't done. So there was interest in it because there was nothing offered out there. So it was really the first time I've been really got a bunch of emails and messages and phone calls from doctors saying, hey, tell me how it works. Tell me what you're doing.
So let me summarize this, because I think it's important it's a take-home message. At least is my understanding and how I would treat myself or a family member would be, at the very first sign, use this diluted food-grade hydrogen peroxide in a desktop nebulizer, not the cheap $25 ones you buy on Amazon. These are closer to $100. Get one of those, and the key here, folks, is to have it in your possession before you need it. An ounce of care of prevention is worth a pound of cure. So have it. Then get the peroxide. If you have to, you don't have to worry about the food grade. It would be ideally to get food grade, but the other one's probably going to work too, and the toxins are going to be relatively minor because it's so diluted. And then you get that ready. And I would do that the very first sign you have it. This is not something that needs to be done every day. I wouldn't do it every day. If you're healthy, don't do it. But if you're exposed to someone who's sick or you have signs and symptoms, I would do it. Now, here's where it gets confusing because there's so many different ways that you can approach this, like your oral protocol. In my mind, the number one thing is nebulized peroxide and iodine. And then preventively, you want to make sure your vitamin D levels are measured in above 40 to 50 nanograms, ideally even 60 nanograms per milliliter by blood test. And you multiply by 2.5 if you're measuring nanomoles per liter. So get that before you're sick. Do that so you don't have to take this mega dose like you're using in your protocol. But I'm thinking, vitamin C and intravenous vitamin C may not even be necessary for you using this protocol. You've got the D optimized and you've got the peroxide on board. And then I would recommend quercetin and zinc early in the course, not late, as sort of an adjunctive therapy. Now, I don't know, maybe, and if you late stage disease, another thing that seems to be really useful is NAC, because in the MATH protocol developed by Merck, which is MATH stands for M is methylprednisolone, A is ascorbic acid or vitamin C, T is thiamine B1, and H is heparin. And heparin is administered because there's a vascular disorder too. There are clotting complications, and the heparin seems to improve that. But NAC will actually go in there and disrupt the sulfide bonds and the von Willebrand factors that leads to the platelet aggregation. So you can dissolve those with something as simple as NAC, which also has the side benefit of reducing oxidative stress and increasing glutathione levels. So to me, the zinc, glutathione, quercetin, vitamin D, and the nebulizer, that is a home run. So now I'm doing it intellectually and academically from all the literature I've reviewed, not in the trenches and in the clinics like you are. So I'm wondering what your feedback is on my approach or recommendation.
Look, I think there's many ways to, I hate to use the word skin a cat, but many ways to, look, hydroxychloroquine should be open for prescribing.
Yeah, if they want to, but use quercetin. No prescription required.
Right. And
I don't know if you're aware of it. The FDA is actually looking at right now from taking NAC off the market because it's useful for COVID.
Of course. COVID's a whole new game, and we've never seen censorship like this. We've never seen draconian measures and lockdowns and whatever that they've done with this. And, I think that if we just could put our intellectual hats on and think about this, and look, I am in the trenches. We were outside doing this work and talking to people, and I'm still talking to people. And I took a phone call this morning from a patient's daughter who was sent home from college because she had it. So I think that there's
So we don't know. I mean,
effective ways to treat this, and we should be studying this. We should be reporting on it. We should be allowed to report on it, and we should be allowed to study it. And we wouldn't have the travesty that's happened to our country.
Yeah, I couldn't agree more. I mean, we absolutely need clinicians like you that can bring the science forward, that are willing to experiment or rationally, not foolishly, with these well-proven, safe, inexpensive therapies that can really address the foundational cause of the illness. So you've done a magnificent job, and I really want to express my sincere gratitude and appreciation for helping others understand this and provide the evidence that yes, indeed, it does work.
Thank you.